Welcome to the web series, The Hero's Call, where champions of safety and justice in the community are profiled. The series is co-hosted by attorney Mark Diller and his colleague, Dr. John Naranja. Dr. John is both an attorney and a doctor.
We're here today with Dr. Amy Fogelman of the COVID-19 Action Coalition. How are you doing, Dr. Fogelman?
I'm doing well. Hi.
Hi, good to see you.
Good to see you.
Dr. Fogelman, you said the COVID-19 Action Coalition. What is that?
It's a grassroots group of volunteers. It's physician-led, but it's students, community leaders, and we are fighting to use science to fight this COVID-19 pandemic.
Tell us from a scientific standpoint and from a medical standpoint about COVID-19.
COVID-19 is a novel coronavirus, which means it's brand new. So that's why it kind of took us by surprise, because we've never seen anything like this before. It was started with an animal, came to humans, and it looks like it started sometime in the fall. That's why it's 19, because it started in 2019. And we started to realize that it was a problem in the United States in probably mid to late February.
Let's talk about the COVID-19 Action Coalition. How did it actually come into being?
So there's a whole community of physicians on Facebook, as particularly physician moms. In February, there were rumblings on Facebook about what was going on in Italy, what was going on in Seattle. And so we were all getting nervous and kind of seeing what was going on with this coronavirus. We didn't know everything that we know about it now, but we knew that it was a really big deal. It seemed at the end of February, beginning of March, that was when the first case, hit us in Massachusetts. And there were a couple of physicians in Massachusetts who realized that we really had a big problem, and they wanted to speak up for it, because what was happening is that hospitals were not all on board with agreeing that coronavirus was a big deal. Masks were not available for all physicians who were being exposed to the virus potentially. So we were having situations where our colleagues were being told, for example, that they had to take off a mask because it was scaring patients, even though the doctor felt like this is something that they wanted to do to keep themselves safe. These were people who had suppressed conditions themselves, and they were trying to keep themselves safe, or they had people at home who had conditions that they were trying to keep safe, and the administrators at the hospitals were saying, you can't do this. Now, I don't want to say it's every hospital. Some of the other hospitals are great, but this was happening in certain pockets, and we were realizing that really what we needed was leadership from above to say, hey, let's get masks for our doctors. So from there, we realized how many other aspects there were with the coronavirus that really we as physicians wanted to get our voice up.
So when you indicated earlier, you were monitoring what was happening in Italy and what was happening when it first came on to, as far as we knew, the United States and came into Seattle. Why did you believe at that point that this was a serious issue? Because I don't think that we in the general public understood this to be as serious an issue.
I think you have a really good point. So what we were hearing from Italy, unfortunately, is that hospitals were not prepared, and there was a particular hospital, and I'm sorry, I don't know the name of it, but it didn't have enough protective equipment for its physicians, and it ended up causing patients who didn't have coronavirus to get coronavirus. That was the major spread of coronavirus in that Italian population, was through the hospital. So that was published in the New England Journal, and it was like a warning cry for physicians that we do not want that to happen in the United States, that it is essential that we, use public health that we protect our physicians, so we're protecting our patients. Because if we're sick, think a regular person sees, maybe, 5-10 people during the day. A busy doctor, we see like 40 patients during the day. If that doctor, like I was talking before, is shedding the virus, they may not even know that they're sick. To those 40 people that they saw, that's a huge problem. And then those 40 people then give the virus to everyone else. So we did not want that to happen here in the United States. And we certainly did not want that to happen in Massachusetts, where we have, arguably the best medical centers in the country.
You then formed this coalition and really has 4 purposes. Could you talk about those 4 purposes?
Yeah, so, the first one is the stay-at-home advisory, making sure that we're mitigating population spread. And so staying at home, physical distancing until the data tells us that it's safe to go back to the way that things are. So that's the first one.
Where did that recommendation come from? How do you know about that?
Unfortunately, because there was a lack of testing available in the country and there was so much community spread, this was the only way that we were able to stop community spread from continuing on such a rapid slope. I'm sure you've heard the term flatten the curve. What that means is if we had continued spreading it at the same rate that we had at the very beginning, that it would eventually overrun our healthcare system the same way it was in Italy. And we wanted to avoid that. So this is a way to prevent that from happening. And then also, similarly, when things start getting better and the curve flattens, looking at the data to tell us when it's safe to reopen.
That's number 1. What about number 2?
Number 2 is PPE, and I did talk about that before. So PPE stands for personal protective equipment, and that's masks, gowns, hats, and we feel that it is essential that healthcare workers, that includes medical workers and people who are not necessarily patient facing, the clerks, the people that are the security, everybody who works in the hospital should not be exposed to coronavirus and should have the appropriate amount of PPE available every day. So we want there to be equal spread of PPE to everybody and that it's safe for all workers.
How about number 3? I have detect and protect.
So what that means is that we need to test people. So when we started out, we were asking for a measly 2,000 tests in Massachusetts a day. And that clearly is not enough. The point is we need to be able to test to know who has coronavirus, to know who's been exposed to coronavirus, to know who's, infectious, so that we can take care of everybody who has coronavirus and everybody who is, potentially at risk from it. But the issue is that the testing sites are not necessarily equally spread throughout the Commonwealth. So there's definitely a lack of testing sites in some of the poorer neighborhoods. That's something that needs to continue to be looked at.
Okay. And then number 4, identify and assist community members.
So what that's talking about is vulnerable populations. There are definitely people that, because of their situation, they're not able to be protected against coronavirus. So an example of that would be the fact that there's racial inequalities that seem to be prevalent in coronavirus. Then, nursing homes. We've seen the horror in some of the nursing homes, how quickly that the virus can spread there. So that's a vulnerable population that really needs to be protected. Other congregant living settings like jails, halfway houses, homeless shelters are other places where people are vulnerable. And because of the living conditions, if someone has coronavirus, it can just spread very quickly in that setting.
So it looks like back on March 10th, that's when our governor had declared a state of emergency to the coronavirus, and it became a much more big deal here. At that point in time, were there rumblings within the coalition about forming a group of doctors to start to take this on?
You know, it's interesting. I don't think it started as rumblings to form a coalition. It was just that people were scared and saying, you know, who's running the show? You know, where are the high ups getting their information? Who's in charge? Like, what can we as just regular doctors do to get our voice out there?
Was this principally occurring within social media?
Correct. Yes, it was within social media. It's amazing, you know, what social media has done for coronavirus. It's the clinical sharing of information between doctors about this is what we're doing at my hospital. Why don't you try it? It has been really, really important with this disease that's changing so rapidly. So yes, I don't think we would have been able to handle this disease 20 years ago.
Later that week, after Governor declared a state of emergency, it seemed like all of the different school districts started to roll out that they were intending to do school closures for finite periods of time. At that stage, what, if any, discussions were you having about how much this had spread into Massachusetts at that point?
There were tons of questions and discussions about school closures. That was a big issue that we all felt like was very important. And some of our members, you know, before the group was formed, but pre-members reached out to their superintendents to explain to them why they felt that it was so important to close schools. What ended up happening as more of our members were having trouble accessing masks at that time, there were 3 members who felt incredibly strongly about this and wrote a letter to the governor. And that was on March 24th that the letter was sent to the governor. And within 48 hours, over 1,000 physicians in Massachusetts signed that letter. Before that, there was some conversations with local community members and people in the Massachusetts legislature about how best to get our voices heard, because we're just a bunch of doctors. So they gave us advice that was write a petition and get it signed. And so then our 3 founding members spent a lot of time back and forth writing this, crafting this letter, making sure that every piece of it made sense, and then got the signatures and got it sent to the governor.
So it looks like on March 24th, 2020, Dr. Fogelman, is when the initial letter was sent to the governor, Governor Baker. And if we could just look at what were the sum and substance of what was being addressed to Governor Baker in that initial petition, the initial letter.
I mean, it was like a letter of wants and aspirations. So we wanted personal protective equipment. We wanted it for everybody. We wanted the governor somehow to procure it magically for everybody to have whenever they wanted it. We wanted testing. If you go further down, you can see that we asked to get rid of public gatherings because we didn't want, you know, that to spread the disease. We wanted personal protective equipment for everybody. We wanted them delivered immediately and equitably so that, you know, no matter what hospital you work for, you would still get the same equipment as somebody who worked for Partners or, you know, a care group. And we wanted easy, accessible, widespread testing immediately available.
Okay. Now, when Governor Baker received this letter, and then I believe later that day he issued a press conference, did you immediately hear him take into consideration some of the things that your coalition was advocating for?
He definitely did. He was trying really hard to get PPE for our Commonwealth. He talked about some of the limitations that he ran into doing that federally, but he was asking different companies to make PPE within the Commonwealth. I know New Balance started to do that, but immediately he really explained to people in a press conference why it was so important for workers to have PPE.
And I believe, if I'm not mistaken, that it was about a week after this press conference, after you wrote the letter, that we all heard about Bob Kraft and the New England Patriots sending a plane to China where they picked up a plane full of PPE and brought it back to the Commonwealth.
That it was really heartening that philanthropies and philanthropic people were doing something to help us. It felt like we were not in this alone. Before, it just felt like we were just expected to do it alone, and all of a sudden it felt like people had our back, which was really nice.
Now, since those letters, has the coalition continued to meet with our lawmakers here in the Commonwealth?
Yes, we have. We had a town hall with Senator Markey. We asked him, what do we do as doctors? We think that these things are so important. And he really said to us, you guys have a voice. You're really important. Keep at this. Keep doing this. Our most important message is that it's science that is the underlying factor with all of this. And we just need to keep on collecting more data so that we can have good data and so that we can make good choices to keep our people safe. That's what we want.
Now, let's talk about where we are today compared to what you were advocating for from the onset.
I think that the governor heard our message about the importance of shutting down the Commonwealth. Our hospitals have not been overrun with coronavirus. Thanks to strong leadership, where we're going to go in the future is to really look at the data and to come to work with economists and to work with business owners to figure out when it is safe and how to reopen the economy. Because we, again, want it to be a medical science decision and not simply, a business economic decision.
What actions do you see in the immediate future that your coalition is going to continue to take to help our community?
We're just, we're here, we're working hard, we're trying to get increasing testing so that we can open up the community and to do so in a safe way. There's nothing more we would like than to open up the economy and to be able to have, as my personal perspective, like it would be great to be able to start seeing more patients in practice. So how do we do that in a safe way where we're not exposing people? We have to use really creative thinking and get all the right people in the room. Our coalition is not necessarily going to be the people who are going to come up with the answers, but we're going to be there listening. And if things don't sound right, then we will definitely be there to tell people, you're going the wrong direction and we think you need to go somewhere else.
Well, great. Listen, I know on behalf of myself and Dr. John, we wanted to thank you for all the hard work and efforts that you and your coalition have been doing to help protect all of our safety and to get us going in the right direction. So thank you. Thanks for all those efforts.
Thanks, Dr. Fogelman.
Keep up the good work. Thanks for doing everything you do.
Thank you. Thank you, guys.